Hello dear friends, I Dr. Singh welcome you all on my YouTube channel Pharma Learning. Today I am going to demonstrate you one of the practical in which you can utilize a zebrafish for performing this practical. This practical can be used at B Form, M Form as well as for the research level. So what is practical? Firstly I will tell you what is the requirement for the practical and what will be the aim of the practical. The aim of the practical will be to check the locomotor activity of the zebrafish in an open field. So that means in this practical you will check a locomotor activity. So before going to locomotor activity, just I will discuss with you basic about the disease, that in which type of disease you can use this type of the practical, this type of the instrument, or you can perform these type of the practicals. So the first thing that in some neurological disorders like Parkinson disease, like epilepsy, like traumatic brain injury, like Alzheimer disease, multiple sclerosis, as well as in autism, it has been found that there is a altered locomotor activity. That means in some disease the locomotion of the person is reduced, or in some disease the locomotor activity is increased. Suppose in Huntington disease you can say there is a hyperlocomotion, and in case of Parkinson disease there is a hypolocomotion. That means hypokinesia, low body movements. So basically what is the role here? There are some neurotransmitter which play an important role. In that neurotransmitter, the basic are dopamine, acetylcholine, GABA and glutamate. So if I will talk about the Parkinson disease, which is one of the prevalent neurological disorder which is affecting a large number of population worldwide. In case of Parkinson, there are two things. The first thing, either there is a reduced synthesis of the dopamine in the striatum, or the second thing, there is a low level of a dopamine in the striatum or in the nigrostriatal area of the brain. Now due to low level of this dopamine, there is a hypokinesia. That means there is a low body movements. Now in the opposite side, if I will say in Huntington disease, there will be a hyperkinetic movement, because at the initial stage of Huntington, there will be a high level of dopamine in the nigrostriatal area, substantia nigra pars compacta, as well as in the striatum. So what does it mean? It means that whenever you want to go for the locomotor analysis of the zebrafish using a open field apparatus, that firstly you should know that you are doing this practical just as a practical for the pharmacology, or just you are doing this one of the parameter in your research. So that means the interventions will always be different. I will tell you one thing, that this type of practicals are very useful if you are working in the area of neurological disorders, because in case of neurological disorder, due to altered level of the neurotransmitters or the neurochemicals, the locomotion, the locomotor activity, or we can say the motor activity is altered. Now firstly I will talk about the aim of this practical. So the aim of this practical will be to check the locomotor activity of the zebrafish using any xyz drug, using a open field apparatus. Now in this I have told you xyz drugs. Suppose if you want to do this practical as a general practical for the pharmacological laboratory, in that what you can do, you can do any fish, you can take any fish. One will be considered as a normal control group and second will be considered as a disease control group. Now in the other case, in case of research, the protocol depends upon your interventions, what you want to do. So the aim of the practical can be changed, because in case of research your work will be wide, and accordingly you will set up your number of group and what you want to analyze using the open field. So what will be the requirement for this open field apparatus? The basic requirement for this apparatus would be, you should know that we should having this apparatus which is having a 30 centimeter length, 30 centimeter width, and overall height of the wall is 10 centimeter. So that means the scale of this open field is 30 multiplied by 30 multiplied by 10. So length, width into height. So this is a apparatus which you can see. I have connected this apparatus through a webcam to a AnyMaze software. In case of AnyMaze software, it is very beneficial that you can directly record or track all the activity of your zebrafish. Likely you can see here that zebrafish are moving in the apparatus. So just for the practical demonstration, I have taken a 3 zebrafish. Now from the bottom side, this apparatus I have divided into a vertical lines. So that means there are 4 columns, 1, 2, 3, 4. So what does it mean? I will explain in the procedure of that practical. But before, you should know that we should have a open field apparatus that can be made up of a plastic or a glass. We should have a webcam, and we should have a AnyMaze software and a one laptop. So simply this is the requirement. And another, the species which you know that Danio rario is required, which is known as a zebrafish. This is the requirement. Now how you will proceed your practical? Suppose if you are doing a general practical for the pharmacological laboratory, you can take only two groups. One will be a normal group, another will be a disease group. So what you will do in a normal group, you will not provide any kind of toxin, you will not administer, you will not inject. The group will be as such same, but the conditions are vary. Suppose if you want to perform this open field, you should at least do fasting of the zebrafish 30 to 40 minutes prior to the procedure of your particular practical. So that means the fasting should be there. Likely you can see, if we want to perform a open field in rats, rodents, we do also fasting for 3 to 4 hours. But here the fasting time should be 30 to 40 minutes. Then you can consider that fish for your practical analysis. Now in the normal, what you will do, you just place a fish here. Before doing the actual practical, you should give a training to the zebrafish for 3 to 5 days. The training interval will be of a 5 minute, and it will be for a two time, morning as well as evening session. Now in the morning evening session, whenever you will see after 3 days, 5 days, the fish is habitual toward that particular apparatus, then on the final day you can perform your reading. Now how you can perform on the final day? That means either on the 4th day or a 6th day after training, you place your zebrafish and record activity. Which type of activity you will record? The first thing, that how many fishes. Suppose if there is a one fish in your practical, then you will check that the lining crossed by the fish in a 5 minute. That you can do manually, or that you can do either using a AnyMaze software, because it can easily track. So I suggest that you should use this type of software, because it will not create any kind of noise or any kind of disturbance. So suppose first parameter you will do in the open field is number of line crossed by the zebrafish in the 5 minute. You will note down, or either you will check from your track software. The second thing, you will check the freezing behavior, that means hypolocomotion. Normally I will say there will be a one thing, that fish can freeze at any area of this software. You can see here, fish can freeze anywhere. But if the freezing can be having a low intensity or a high intensity, sometimes you can say fish can freeze at a one place. This will you be considered as a score or as a freezing time. Second thing, sometimes the fish is freeze but show hypolocomotion. That means fish will be travel from point 1 to point 2 centimeter per second or a per minute. So that means you can calculate the freezing time, or secondly the hypolocomotion. And the third thing which you will calculate here, that how much time the fish will stay in the corner of this apparatus. Because this is simply the thing, whenever you want to say that we want to kill anybody, but we have keep a one person in a particular area where the person is surrounded by a wall, and you want to gun shoot that person after a one day. So what he will do, he will either want to strike with the wall, and either he will want to stay in the corner, that he will not be visible to anyone. So likely this is the condition of a normal fish. Either the fish will travel more and cross the number of line, you can check. The second thing, either the fish will freeze at any particular area due to anxiety, and the third thing, either the fish will stay in any corner. So these three things are recorded, but fourth thing in some practical they will take, which is called as a mirror biting or a glass biting. So this is the severe anxiety sign. This you can do if you are doing any of your PhD MPharm research work. So there are four things you can do. First thing, number of line crossed by the fish in a 5 minute. Second thing, freezing point or a freezing time of a zebrafish. Third thing, hypolocomotion. And the fourth thing, if the fish bite to the surrounding wall or any mirror if you have placed here. And the last thing that you will check here, that how much time the fish will stay in any corner. This is a sign of anxiety. So this practical you can do in a normal group, and this you can same do after once you induce a disease in any zebrafish. How you can induce a disease? If you want to check a locomotor activity in Parkinson, then you can do Parkinson in zebrafish by using MPTP, rotenone, 6-hydroxydopamine. If you want to induce Huntington, you can use a 3-nitropropanic acid, quinolinic acid, like that. So these are the toxin which the model you can use. So this is the apparatus in which you can do these practical. And the second thing which is important to note down, if you are doing your MPharm research work or PhD work, I have discussed about only two groups. One is a normal, another is a disease. But in your protocol, if you have a 5 group, 6 group, likely the protocol will be same, but you will differentially perform for each group. And at the last, what you will conclude, first thing, that the number of line cross in a 5 minute, you calculate it in the observation table. The second thing, the freezing time of the fish. The third thing, the fish stay in the corner. And the fourth thing, if you are additionally doing that, if fish bite to any mirror or wall of the apparatus. So basically this is the experiment which you can perform in your laboratory, and these are the result. Suppose if you will see, you will compare normal group with your disease group, and disease group with your treatment group, and if you are taking any standard drug, then you can compare your treatment with the standard. So likely you can perform this type of the experiment. Now I will tell you what are the limitations of this practical. The first limitation is, if you will not do a proper training of the zebrafish. Normally zebrafish is having a behavior to walk more. Normal fish will travel more in the boundary side. It will not travel in the center, because fish will think so that the fish will suffer from any kind of the fear or any kind of the injury. Likely you can see I have given example of human being. If you want to kill a human, so that mean nobody want to expose toward directly gun shoot like that. So that's why the normal fish more travel in the peripheral area. But if you will induce a disease like anxiety, Parkinson, Huntington, then might be the traveling will be little bit more in the central arena of the apparatus. So this is the first limitation, that if you will not do training, fish can show abnormal activity in the anime software. The second thing which is important to note down, that if you have already stressed the fish, then there will be a difficulty to get a good reading or get a observation which are required as per your practical analysis. So today I have discussed with you what is the use of open field apparatus in the zebrafish, how can you use a different group analysis. Hope this practical was very useful to all of you. You like and subscribe this Pharma Learning channel. You all are welcome. Thank you very much.